Welcome to the DoubleACS Daily News. Like in many parts of the country, Sturdy Memorial Hospital has seen an increase in hospitalizations due to COVID. DoubleACS recently spoke with a representative from Sturdy Memorial Hospital to see how they're weathering the COVID pandemic. Here's the second part of our interview.
The reason why COVID is spread to 70 million people across the world is because you have a certain point where there's no symptoms and yet you can spread this virus, and that's, for 48 hours you can be walking around or more spreading this virus before you even develop any symptoms. And some people remain asymptomatic, and these are the things we have to consider. Letting our guard down would be a terrible thing at this point in time, because we're so close to having a situation, hopefully by the middle of 2021 or toward the early fall of 2021, where we may achieve, if everybody is compliant, that 70 to 80% of the population vaccinated that we need to achieve this so-called herd immunity. We are far from there, so we need to be extra vigilant to keep this going. Well, the vaccines are wonderful. It's unprecedented in terms of, when we do roll this vaccine out and we do get this vaccine, it's sort of incredible. There's a lot of talk about the Pfizer vaccine and the Moderna vaccine because these are the first to come up for the emergency applications to try to get the vaccine rolled out. The effectiveness of the vaccines is incredible, between 90 and 94, 95% effectiveness. The profile in the Pfizer study, where they looked at 43,000 patients, the only major bad effects of the vaccine were fatigue and headache. So you can feel lousy after getting your first dose of vaccine, but then you sort of perk up after 24 hours. And don't forget, there's the concern and the fear regarding the vaccine is that if you get people to come in and get that vaccine, it's a two-part process. So you have to come back 21 to 28 days later to get that second dose. And in terms of letting your guard down, the vaccine's not here. It's simply not here now. And it's not only for ourselves, it's not only for our family, but we're really trying to protect our neighborhoods and protect our friends and our friends' families. So all the stuff applies in terms of prevention of transmission, wearing masks, washing your hands with a 60% based alcohol solution, not touching your face, making sure you wash your towels. If you're potentially having symptoms, or if you feel like you're having symptoms and you could potentially transmit, making sure that you don't share towels at home, that you isolate. All of these things are important, and when they come to our hospital, when they come to our emergency department, we make every effort to make sure that we screen people appropriately, so when they come here, folks can be appropriately partitioned and we're not becoming part of the problem, and you're segregating people so that if you have symptoms, we can get those folks with the ankle sprains or fractures in one area and the folks who have worrisome signs and symptoms in another area. So there's a lot of planning and logistics that go into this, and I think we're doing an excellent job. And our team, our COVID team, has been working hard for 9 months now, or 10 months. It's 11 months. All these months that we've been going through, these wearying months, and I think that the public really appreciates it. When I talk with patients, I find that there's when they're coming into the emergency department and they've had to wait, or they see how many people are sort of needing help. I'm happy to know that there's a certain level of understanding these days that I'm seeing, because we're all sort of pulling through this at the same point in time, and I'm grateful to that. And I wanted to thank everybody in Attleboro for their understanding as we sort of try to keep everybody safe. I'm hoping that we're all caring for ourselves well in terms of our mental health. And one of the things that this disease, this pandemic, has done to us is it separated us, and physically separated us, and made us wary of each other in terms of seeing each other as vectors of a disease. And I think that's a really sad thing. And I think that we should find ways to reach out to each other that to maintain our humanity through all this. And I do hope that we take the time, at the very least. Sometimes our words of kindness are the only things we have to give people, and the way that we used to give embraces. And I feel like, please, if you do one thing, you can wear your masks and do all these things that I hope you're doing, but also, remember to sort of reach out to people and give them comfort, because I would like people, especially at a time of year when we're so close to getting to a solution, I want people to maintain that hope.